I want to share some new training videos showing you how HippoScribe, the AI scribe for physical therapists, occupational therapists, and speech language pathologists, can be used and rolled out correctly. I always say it's a tool like any other tool. If you give a 3-year-old a hammer and don't teach him how to use it, he's going to break a window. But another person could use a hammer to build a house. I want to teach you how to build that house. Let's jump in. I've created some space in my EMR. It works with any EMR. There is nothing special about integrations, even though other Hippo scribes talk about how to integrate with an EMR. It really doesn't matter. There's a structure that you want to understand when connecting to your EMR. So here, this is a real EMR. I am the patient in this scenario, Anthony Maritato. I'm going to go to appointments. I'm going to go to a new evaluation, click for evaluation. And basically, what you're going to see here is you have templates in every EMR that you have set up. Let's go with a lower extremity functional scale template. Now, I will typically use this for a hip, a knee, an ankle, difficulty walking. I'll use it for all sorts of lower extremity conditions. But basically, when you look at this setup, what you see here is, like most EMRs, there's tons and tons, loads and loads and loads of information. There's a lower extremity functional scale, there's interventions. I pre-selected exercise manual and gait training. You have information for vitals, you have information for observation. For me, using an EMR, I never populate any of those fields. I get the information, but I put the information into centralized documentation areas. So for me, I would use history of present condition. And what we're going to do is we're going to create a template right now in real time that you can use in HippoScribe. We copied history of present condition, mechanism of injury. I'm going to go into ChatGPT, and you don't have to use ChatGPT. You can use any feature that you want, any AI. But it's just easier to get another AI to generate the instructions. So I'm going to say, let's create instructions for HippoScribe template. These are the headings I want to use. Then we start dropping in the headings. So I use past medical history. Now, like, I don't put a pain score in here because I'm going to put the pain rating in the assessment or somewhere else. I'm not going to populate imaging because I'm going to put that information somewhere else. And so a lot of these now I will use current and previous level of function. I will use occupation job description. Patient goals, again, I don't understand. We're going to use that somewhere else. This is a predetermined lower extremity functional scale. We'll just skip that for right now. The interventions, you're all going to use different interventions. You can skip that for now. The other ones that I typically use, range of motion. I use strength, which I'll show you that right here. I don't do special tests, and if I do, I would put them in somewhere else. And then assessment. Now you keep scrolling down. So stuff like rehab potential, it's a drop down. Stuff like, is there a functional impairment? Clinical complexity. Everybody is low complexity by default unless they prove that they're more than low complexity. So a lot of these things you can pre-populate. If I jump down here, like goals, I'm going to obviously need goals. So we'll come down here and we'll say goals. Okay, so this is basically, these are the categories that I want to populate. And then what I want to do is I'm going to say, let me see, 1, 2, 3, 4, 5, 6, 7, 8. Those are the 8 categories I need populated with all of the recorded information. Actually, what I can do is I can click this. HippoScribe is an AI scribe that has both ambient listening and dictation features. So what I typically do is I record the initial portion of the interview with my patient, then I provide a dictation explaining all of the clinical findings. What I would like you to do in these instructions is to use your understanding of required clinical documentation for physical therapy evaluation and provide instructions to HippoScribe under each of those categories for what information should be extracted from the audio recording. All right, I hit the check mark, I let it render, and let's see what it comes up with. Now, there are absolutely specific criteria that we can use. I just want to kind of give you guys the general idea. So, like history of present condition, right? Summarize the main reason for seeking therapy, the onset and nature of the symptoms, any relevant or details about the condition develop, extract from the audio, chief complaint, date of onset, mechanism of injury, description of pain, functional limitation, patient's stated goals or expectations for therapy. Clinical dictation may include therapist summary of findings, clarification of mechanism, interpretation of patient reported history. Then we've got past medical history, what to pull from the audio, current and previous activity levels, occupation, everything that we need, all put in here. Now, you see these as bullets. When I copy and paste over to Patient Studio, bullets don't come over very well. So what I'm going to do is I'm going to say, let's make some changes. Don't use bullet points. Everything should be written in narrative format. And then, so then I'm going to say for goals should use SMART framework. I want one goal for each date of service. So I'm going to say each visit in the plan of care. For example, if my plan of care is 6 weeks at a frequency of 2 times per week, I need 12 goals. 25% of the goals should be impairment based. This means pain, ROM, swelling, balance, etc. 75% of goals should be function specific and limited to self-care and home activities. Do not include recreation or leisure activities in the goals or the assessment. Recreate this information in a structure, that I can copy and paste into my HippoScribe template. All right, let's see what it creates. I'm going to stop sharing for just a second. I'm going to go into my actual HippoScribe account. I'm going to go into the templates section. I'll bring you guys back over now. We're going to create a new template, top right, create a new template from scratch. You know, Jansen made some updates and he gave us some instructions here. but let's give these instructions a try. Okay, HippoScribe template instructions. We're going to copy implementation notes. That's fine. We're going to copy all of that. We're going to come back over here. We're going to click add a section. We're just going to name this valuation. We're going to drop those instructions right there. I'm going to hit save. And now what I'm going to do is I'm just going to dictate a note. I'm going to pretend I stopped sharing. I'm going to pretend that I want to see if I can hide that. I know you guys can't see it. Okay, I'm going to bring you guys back over now. I'm going to pretend that I did the evaluation, but let's say for whatever reason, I couldn't do the ambient listening. I hit start. Today's patient is Anthony Maritato. He's a 50-year-old male presenting with left hip pain. He reports insidious onset of left hip pain. His pain is localized to the greater trochanter and consistent with trochanteric bursitis. Past medical history is asymptomatic. Anthony has no history of complexities or comorbidities that may impact his return to premorbid status. History of current illness. Anthony reports going on a hiking adventure 3 weeks ago. Prior to that, he had no hip pain. After that, he reports severe hip pain, rated 9 out of 10 at worst, 6 out of 10 on average. He is not taking any over-the-counter medication or prescription medication. He reports no imaging such as MRI or X-ray. Anthony is a full-time physical therapist working 40 hours a week. He reports his occupation requires prolonged standing, walking, moving, and demonstrating exercise activity for his patients. Range of motion is within normal limits for flexion extension, hip internal and external rotation. Strength is impaired by pain, specifically with hip abduction. Current functional status and prior level of function. Anthony reports prior to onset, he was pain-free and independent with all work and home-related activities. Current level of function, Anthony is experiencing pain sleeping on the involved lower extremity. He reports pain with dressing, squatting, lifting and carrying, crawling, and rolling. Assessment, Anthony presents with no signs of cognitive decline. He's alert and oriented at person, place, and time. He reports being able to learn and follow instructions. He enjoys exercise and is eager to return to unrestricted work activities and his previous fitness program. Anthony has a membership at a local fitness facility, but he has not been exercising since the onset of symptoms. I'm prescribing a 3-week plan of care with a frequency of 2 times per week. Okay, best I could do. I'm just making all of that up. But let's see. I'm sure there were some things in there that made you cringe when you heard me say it. But let's see what we've got coming. I'm going to pause the recording until it's done. Okay, here's the finished output. So we've got Anthony Maritato, 50-year-old male, reports insidious onset left. I had forgotten which side I said, so that's why I stopped saying right or left. Left lateral hip pain beginning approximately 3 weeks ago following a hiking outing. He did not note a single trauma event during the hike. Symptoms developed over subsequent days and have persisted. He reports pain localized to the lateral hip over greater trochanter region and is consistent with trochanteric bursitis and quality. Describes aching and sharp provocation when loaded. Okay, so ton of good information. Past medical history. During today's interview, no references were made to past medical history that may complicate or impede return to premorbid status. I had said there's no complicating factors. There's no, diabetes or hypertension or any of that stuff. Prior to onset, patient reports pain-free and independent with all work and home related activities, including walking, transfers, bathing, dressing, stairs. So you can see that it's starting to pull out the things that the insurance company really cares about. Currently, he remains independently mobile, but experiences pain with dressing, especially tasks requiring hip flexion and rotation. Now, I didn't specifically say that, but it's consistent, so I'm not going to worry about that. But let's say you were like, absolutely, I do not want that. Okay, delete. I just hit the delete button and it's gone. Bed mobility, including rolling, functional transition, squatting. Okay, we got all that stuff. Employed full-time therapist, works approximately 40 hours a week. Relevant physical demands, translate home ADL, include prolonged standing, meal preparation. I didn't say that, but it's appropriate. If I didn't want it, I can just get rid of it and just leave it at standing. Frequent walking during household management. Left hip active range of motion reported within normal limits. Flexion, extension, internal, external rotation. No protocol imposed. Blah, blah, blah. Manual muscle testing reveals pain limited strength for left hip abduction. That was the one I specifically said. Specific grade not qualified today. So I don't remember if I said, 2 minus or 3 out of 5. I don't remember. But function. So if I go back to the transcript, usually you can find here strength impaired, specifically with hip, current functional status, and prior level of function. So I don't really have, the number there. All right. Assessment. Anthony presents signs and symptoms consistent with left greater trochanteric pain syndrome, trochanteric bursitis, characterized by lateral hip pressure, pain limited hip, abduction strength, yada yada. These impairments directly restrict dressing, hip flexion, rotation, and single limb stance. Again, I didn't say that, but that is good information. Bed mobility, rolling, squatting needed for lower cabinet access. I didn't say it, but that was awesome. Lifting, carrying, household management, sleeping on the involved side. Skilled physical therapy is required to provide clinical decision making regarding graded loaded progression to hip abductors and lateral hip tissue. Manual techniques. I didn't say this, but this is what I would do to reduce soft tissue irritability, targeting, strengthening motor control, pelvic and hip stability, blah, blah, blah. The need for licensed physical therapist or physical therapist assistant under the supervision and direction of a physical therapist is justified by the requirement for ongoing assessment, titration of load, and range-based symptom response. Application of manual therapy, prescription of exercise dose and progression criteria to prevent exacerbation while restoring function. Prognosis is good given the short duration of symptoms, high motivation, absence of complicating comorbidities, with expected improvement over a 3 week plan at a 2 week visit per week. Plan of care at 2 visits per week. Contingent on adherence to home program and activity modification. And then it gives me goals. I've got a little blurb in here about home exercises if I did it. But that's it. That's awesome. Now you guys see these little BBBs. That is because the way I have created my templates is I would copy this, Control C. I would go here to my template. You can see it's generally blank right now. I would hit a little shortcut button. Okay. And then what it does is it auto-populates everything. It auto-populates my HPI. It auto-populates the past history, current functional status, occupation, other stuff that's already there. It just leaves it there. This is basically the way I do my evaluations. Then for the goals, I would separately populate the goals. Unfortunately, the way Patient Studio works, I can't dump 10 goals in at once. So I have to go one goal at a time. But the main thing I wanted to show you guys today was how to use ChatGPT or Gemini or Grok, whatever you want to use, to create the framework for your documentation template, and then copy paste that template into HippoScribe so that you can now start testing those customized templates. And what I would do is I would basically create different templates based on different episodes of care. So, you could see in my patient studio, I have like um, lower extremity, upper extremity, post-surgical, non-surgical. But even within HippoScribe, you can take those, and if you really have something special that you do, like you do a lymphedema, or you do a pelvic floor, or you do something else that requires specific programming and instructions, create a separate template in HippoScribe so that you can click and choose the template that you want in the dropdown. If you're still watching, couple little details. If you notice, I don't have different fields in my HippoScribe template. Everything is in one field because what I find is that I can control the instructions and control the outputs way better when I put everything into one field. And I'm going to be copying and pasting over into my EMR anyway. So it doesn't really benefit me to have different fields, although logically I know that is the way most therapists are thinking. They're thinking a field for this, a field for that, a field for the other. That's when you run into a lot of duplicate information because each one of those fields is almost treated like a separate ChatGPT, line of thought. So one field, put everything in there and just extract the information that you want to populate the fields that you need. All right, guys, I am going to create more training videos like this. If you want more information, absolutely let me know. Post questions in the comments and I'll address those specifically. But otherwise, we're done.